conversation that needs to be held. Did you know that in 2018, CDC accounted for youth ages 15 to 24 to be a part of the 26 million newly cases of STDs? So just imagine what those numbers look like now. Come with me so we can come talk about it. I'm Moreland, senior psychology major from the Motor City, Detroit. Now we can really get into the discussion. Y'all ready to talk?
Yeah.
Let's go. In many communities, STDs are viewed differently based on cultural beliefs, socioeconomic status, and access to healthcare. For example, some communities may stigmatize discussions about sexual health or view STDs as a taboo topic, leading to avoidance of testing and treatment. Additionally, disparities in healthcare access and education can really make differences in how STDs are perceived and addressed among different communities. Let's understand the influences. We got peer pressure, societal norms, and cultural attitudes that basically shapes individuals' behaviors related to sexual health. Peer pressure. A lot of the times, and especially in our day and age, it's like, oh, we don't use condoms. We don't do those type of things. We don't talk about sexual health. We don't go get tested and stuff like that, which brings up societal norms. So we want to keep on disregarding the fact that we should be bringing up these conversations regarding sexual health, but instead we don't do that. So that's going to influence decisions about sexual activity, condom use, and communication with partners. And societal norms, again, is reinforced through social media, family, social circles, and they dictate the expectations and the perceptions surrounding sexuality, which can impact, again, the individual's willingness to seek sexual resources and engage in safe practices. Emphasis on safe practices. Additionally, cultural attitudes towards sexuality vary widely and can influence beliefs about STDs, contraception, and healthcare seeking behaviors. And now that we're talking about healthcare, let's get into the real tea. There's so many disparities in healthcare access and education that further stretch differences of how STDs are perceived and addressed across communities. So access to sexual health education varies significantly depending on the factors such as socioeconomic status, geographic location, and cultural background. In a lot of our communities, especially in the African American community, we lack adequate sexual health education programs, leaving individuals with limited knowledge about STDs, prevention, and treatment. Additionally, disparities in healthcare access, including insurance coverage and availability to resources, can hinder individuals' ability to access STD testing, treatment, and preventative care. These disparities continue to differing levels of awareness, testing rates, and treatment outcomes across the communities, and understanding the importance of understanding the structural barriers to sexual health services. Y'all still listening? Okay. So let's take action on campus. Out of all the things that we talked about, peer pressure, societal norms, us not wanting to have conversations surrounding sexual health, we're going to take 3 steps, maybe 4. First one, let's advocate for comprehensive sexual health education on campus, off campus, and just in general. Third, let's encourage student-led initiatives to raise awareness and promote safer sex practices. And let's share examples of successful stories and stories just to let students know that you're not alone. We're in it together, okay? And emphasize the importance of covering topics such as contraceptions, STD, and STD prevention, and consent. Heavy on the consent, okay? Can I talk about affordable healthcare and healthcare in general and how there's so many disparities within that? First of all, we need schools to make these things more accessible, these conversations to be more accessible to college students, because it's not fair. We don't have a lot of conversations regarding sexual health. So how do you expect us to know it? How do you expect us to know these things? But that's why I'm here to educate you. Access to healthcare services. So colleges and universities literally play a vital role in facilitating access to sexual health resources for students. For example, on campus, we have our Health and Wellness Center, or our Wellness Center, Health Center of Alabama A&M University, which gives students the opportunity to learn more about sexual health. But We need to take more initiative to go into campuses, to go into dorms, making sure that everybody is understanding this information. So, on-campus health centers should be staffed with the equipped healthcare providers, and also with the healthcare providers, we don't need nobody who's going to be messy. Why are you in there being messy talking about these people's business? That is not their business, and you are disrupting confidentiality, and we're not going to do that, okay? And that's where the stigmas come from. Stigmas come from healthcare providers, from friends, from family. We need to stop the stigmas. Stop the stigmas, okay? By removing these barriers, colleges and universities can create a supportive environment where students feel empowered. I have to say that for a third time. So they can feel empowered about prioritizing their sexual health, having conversations about sexual health, and seek necessary care when needed. Because a lot of the times, we don't want to seek help. But no, let's seek help so we can stop the STDs, okay? I hope that today's TED Talk was very informational. I hope that you learned a lot about the rise of STDs and how we can help students on campus make sure that they're having safe sex the right way. Maybe you should take some of these to go with you. I think you need them. This video was brought to you by Jean-Moné with sources from the CDC.